Today, I'm very pleased to join with the city of Jacinto City, the mayor and council members, as well as the city manager and all of the staff, the police chief and fire chief, and to express our appreciation for all of the work that they have done. We're standing in front of a ambulance, the Jacinto City ambulance, that we were able to partner with them to secure. But the reason why we have it here is because this is the facility or the vehicle all over the nation that provides the transportation of people sick with coronavirus. Sometimes we don't recognize the vitalness of different assets that we have. And all over America, ambulances are taking people who are sick with the coronavirus, but as we have heard in some of the epicenters, they're running out of hospital beds and ventilators. So we're going to be working around the clock as members of Congress to push the federal government to put up these pop-up hospitals. We know that our community is getting prepared to find other facilities if necessary to make sure that we do not run out of ICU beds or hospital beds. We are joined in this effort by UMMC, who a couple of weeks ago opened up a 46-bed unit for ICU patients and non-ICU patients suffering from the coronavirus. Some of us are aware of those patients who have been treated, and some of them have been released. So my point this morning is to acknowledge the work that we think is still to be done, and that is to test persons 65 and older. We made a real impact by opening up the North Forest, Forest Brook Middle School, by opening up Forest Brook Middle School, which we've seen that most of those who were tested were 55 and older. With that in mind, we think we've gotten through the UMCC and the county and city sites that here in Harris County, we've been able to test a sampling of all of the demographics of our community, Anglo, Asian, Latino, African American, and a broad cross-section, and we're continuing to try to make sure we get our seniors and to make sure that we get our law enforcement. And obviously all first responders. That is what we do today in Jacinto City, to be able to add to understanding where the coronavirus is, how do we help those who are positive, detect those who may need hospitalization, who are asymptomatic. The more data the scientists and doctors have, the better off we are. So I am grateful to Mayor Diaz for her very active participation in saying yes as soon as I called her to say we will work with you in a site here. And I want to thank City Manager Squires and his team for immediately, within a short period of time, answering the call and indicating that we will open our doors and make our city available, but make our facilities available to work with you and work with UMMC. Let me acknowledge Constable Chris Diaz, who has been a collaborator with Chief Ayala in the security. We are very grateful for his leadership, and we thank him so very much. We want to acknowledge Dr. Constance Jones and Dr. Candace Matthews. We're very appreciative of their presence here. They have joined me on a number of occasions, and they work with the most vulnerable in our population, and we're very glad for their presence here. I acknowledge Dave Matthews, and I acknowledge the mayor and council members. I don't know if they are here, but I know they are working everywhere throughout the city. We want to acknowledge our medical professionals, and we certainly want to acknowledge Elizabeth Flores, who I work with all the time, who leads our seniors, and we could not have done it without her. When we called Elizabeth, she couldn't have said yes faster to get her seniors here, and we're so grateful. I'm going to just give her an applause because she takes care of these seniors every day. And to our medical professionals, we're very grateful to you. So again, we are here to answer the CDC's call and the NIH call about testing and to test as broad a base of people as possible. We wear the masks and I wear the gloves just to indicate that we're also complying with the recommendation of the Centers for Disease Control when we go out to wear a mask as necessary. I'd like to now introduce the mayor of the city of Jacinto City, and that is Mayor Diaz, for a few remarks.
Good morning. I am the mayor of Jacinto City. My name is Anna Diaz. First of all, I want to congratulate and thank you so much to Sheila, our Congresswoman Sheila Jackson, for what she does for our community. For those that don't know, she does so much here for our community. She helps our senior programs, and she does anything that we call her to ask for any help. I want to thank all the law enforcement officers here and all the medical team here, and thank you so much for coming to our little, which I like to call our beautiful city of Jacinto City. Thank you so much. Thank you so much for Elizabeth, what she does for our seniors here, and we are here to help our community. We are a strong family. We stick together, and we will fight this. Jacinto City will fight this coronavirus. Thank you.
Thank you, Mayor. As I indicated, we partner on this all over the community with UMC, and I want to acknowledge Dr. Moeen, who is the operations CEO, and I want to acknowledge the CEO, and that is Mr. Saeed Mohidin, and I'd appreciate his remarks at this time.
Good morning. Our UMC mission is to save lives, serve the city, serve the state, serve the nation. And we are here today to make sure that we take care of our seniors. And we thank you for the mayor, for Jacinto City, the police chief, and the city manager for allowing us and inviting us and to coordinate this fight against the coronavirus. Thank you.
Thank you very much. The whole team works every day. I want to thank Dooney Hebram, who is head of federal relations. Thank you so very much. We will hear from our chief medical officer, but let me indicate why I believe the work that we're doing is part of saving lives. That's why we keep driving toward opening up testing sites in the midst of the fight to not become an epicenter, to not become the cities that we are so sad and so compassionate about. Detroit, New York, Washington State that's really doing, coming down on the other side, California that's working very hard. But as Governor Newsom has said, he's still got many, many people who've not been tested. And of course, our sister city, New Orleans. We are trying with this effort to not become an epicenter because we don't know where the cases are in our community. So UMCC has screened 3,030 patients at the Tidwell Center, the West Tidwell Center. Forest Brook, that has just been open for 2 days, now open today on 7525 Tidwell, 413. And Sugarland, that was open last week and continues, 446. The median age at Tidwell, if you can imagine, was 26 years old. At Forest Brook, 49 years old. Sugarland, 52 years old. We are continuing to try and test our older population. Positive patients, 285 at Tidwell. Forest Brook, 2. Sugarland, 35. The mean age, again, in the positive is age 37. In Forest Brook, 65. And Sugarland 44. So it is important to note that that is a major dent in our community compared to what others were able to do before they reached the epicenter. So I'd like Dr. Joseph Barone to come and to explain what we have done and why this is important. Dr. Barone.
Thank you, Congresswoman. What we have done has been this gigantic outreach. Your direction has been obviously vital to what we've done. From what the Congresswoman was telling you, just think about it. A lot of young people are being tested. And today we are here because we want not only to help the first responders, but also seniors. On our data, which is more than 4,400 people tested, the vast majority of them were people that were relatively young, and yet there were not enough seniors. Why? Because maybe the seniors cannot come to us, maybe the seniors are reluctant to come to us, so based on the direction of the Congresswoman, we decided to bring the testing to them. And that's what we're doing here today. We're trying to test as many seniors as we can possibly do. Now, in regards to the second question, with respect to the mask and the gloves, I know that you have heard a lot of conflicting information on the news, on different outlets. We believe that following recommendations from CDC is probably one of the most important things. Wearing the mask doesn't protect you, but it protects the others. I think that that's the primary concern. Wearing gloves, which I'm not wearing right now, is indicated if you're going to be touching a surface that you're not familiar with. We know that the virus can stick around surfaces now for up to 3 days. So, I don't know what I'm touching, so it's not unreasonable to wear gloves, provided that you don't put then the gloves on your face or things like that. Thank you. Ahora en español. Estamos aquí el día de hoy porque queremos poder ayudar a la gente mayor de edad. Mucha gente mayor de edad no se le hicieron pruebas porque no podían venir a ninguno de los otros centros que teníamos o por cualquier cosa como tal. Entonces hoy el United Memorial Medical Center, bajo la dirección de nuestro jefe del hospital, al igual que la congresista Sheila Jackson Lee, venimos aquí a ofrecer el servicio de identificar quién está infectado, quién no está infectado, y específicamente queremos ver a la gente mayor de edad, porque la gente que vimos anteriormente era generalmente gente relativamente joven. Por eso estamos el día de hoy aquí. Además, la otra cosa de la que hablamos es el usar mascarillas. Quizás no te proteja a ti, pero puede proteger a otra gente. El usar guantes, lo recomendamos cuando no sabes qué es lo que vas a estar tocando en superficies en las cuales no estás conocido. Gracias.
We thank you so very much. These is the data that we have. We have one last speaker, and then we'll take a few questions. I'll make some concluding remarks. But I do want to acknowledge again the fire chief and the police chief who were out meeting with us, and we are very grateful, Mayor, and to City Lawn, we're very grateful for their service. And so, representing law enforcement, we'd like just a brief word from Constable Diaz.
Good morning. Some very harsh times right now, challenging times, but I'd like to thank all the community partners for coming out. We need to look after our law enforcement, and it's something that's very important right now since we're on the front line. All our brothers and sisters out there, we want to continue to take care of you so that way we can provide public safety and make sure that all the citizens of Harris County get a fair share and we can fight this virus. But we all have to take the necessary precautions, as wearing gloves, our mask, stay at home if you can stay at home, and God bless. And again, I'd like to thank our city, our mayor, our city council, all of our EMS, everybody in the health business. We have to stick together. We will fight this virus. It's challenging times, but we're together. We're one unit, and we have to fight this. Thank you.
Thank you very much. Members of Congress will be on conference calls. We're getting ready to do our fourth stimulus, And I just want to make sure that one of the things, based on the information data from Houston and Harris County, we will be seeking added funding for free testing. The testing period has not ended yet, to be able to find the pockets of individuals, not only in this area, but Texas and throughout the United States. One of our concerns is rural Texas, even though the population is not as densely populated as the urban areas. We're going to fight again for our small business relief and expanded unemployment, because many of our stay-at-home persons are having difficulty in accessing the unemployment. We're committed to making sure that everyone has access to unemployment, the 13 weeks, the $600. Having given out 2 days of food, I believe that we're going to have a large period of food insecurity, and therefore we're going to be looking to get more funding to make sure that Americans don't go hungry, and particularly our children. It's in certain areas. We thank HISD and other school districts for working with our school children, but food insecurity is going to be crucial. And then as I have listened to the debate, I am really believing that the president should call for a national stay-at-home. That means that all states that have not yet done so, I believe that they should look real hard. As the U.S. Surgeon General has said, give us a week of stay-at-home for the non-essential persons. Give us a week for all states in the United States to be able to help their fellow brothers and sisters in places like New York and the eastern corridor of New Jersey and Connecticut, in Detroit, in Louisiana. Stay at home to be able to have the medical professionals get a handle on this and to be able to look toward the other side. In Houston and Harris County, great work by our local officials, but we don't have the next step that would allow us to say we're already through it, we're over it, and it's behind us. Help us, Mr. President, by putting in place a national stay-at-home order at this time, as the U.S. Surgeon General has asked us to do. Any questions? Yes, sir.
Yeah, Congresswoman, I might have missed it in your first statement, but is today's testing completely at no cost to the people that are testing?
It is completely, and I'll let, the federal government has guaranteed free testing. And so I'll let Mr. Mohideen answer that.
Your question, sir.
Is today's testing at no cost to those that participate in the testing?
That is correct. There is zero cost to any patient for COVID testing.
The federal government has promised, and that's why one of the things that I'll be advocating for in Stimulus 4 package, Mr. Jermail, is more dollars to ensure that our facilities can test people at no charge, which is very important. Anyone else have a question? Then let me close my remarks by indicating the catastrophic moment that we are in, and to thank all of the medical staff at UMCC added to the broad global medical staff, and to reinforce something that I've said over and over again. We do this to save lives, and to recognize that everyone is at risk, and the reason is because you can spread coronavirus, which is extremely contagious, being asymptomatic. So it is important to know if you're a carrier, because you can be at home with family, seniors, people with underlying health conditions, and you are a carrier. And so we don't take this lightly. We will continue to work with our communities and help as much as we can, because again, the underlying issue is saving lives. And we will work with our county and city officials to do so. Just this past week, myself and Congresswoman Sylvia Garcia wrote to the President and FEMA Director on the need for more public testing, to indicate that we could not suffer the cutting off of Texas Harris County, or Houston from getting test kits. We're glad to announce that in a conversation that I had with Rear Admiral from HHS and Administrator Gaynor, that they are going to continue delivering to the city and the county test kits that are going to help them continue their tests, complementing the tests that are being done by UMMC. So again, this is to save lives, and we could not do it without the early work that was started by this hospital on March 19th. Thank you all very much. I think we need to go on, and I know that the testing has begun, likely, to test seniors and to test our first responders. Thank you all very much. God bless all of you, and God bless the United States of America. Distance.
Stats you read out, those are the ones that I'd like to have. If you can have somebody send them to me.
Okay, take your camera and take a picture of
Yeah,
it,
I can do that.
and then you can read it, because we can't send anything out. We're short-staffed.
David, Carter now.